Abdominoplasty is more commonly called a tummy tuck, and it really covers a wide range of operations. We get patients who come for tummy tucks who may be massive weight loss patients, which we commonly see now, who have large hanging abdominal aprons, down to patients who have had a cesarean and have a little roll hanging over, who have fantastic figures but have had a cesarean and just have a little roll of skin hanging over the cesarean scar. Abdominoplasty really involves two elements, no matter how big or small it is. It involves potentially tightening the abdominal wall muscles, which have been stretched most commonly from having children, and then getting rid of any excess skin and fat from the abdomen. Almost universally now, I would use liposuction in association with abdominoplasty. This allows you to do that more refined, expert job, such around the love handle area, can tone areas down, reduce fat, and just really sculpt the final result into something which is A1 and better. The great conundrum is always, can I have liposuction and no scars, or do I need a tummy tuck? The decision between them is pretty easy. If you've got excess fat and good skin, liposuction's a tool, because it's a tool for removing fat. Once you've got excess skin, or skin that's of very poor quality, such as stretch marks, the only way to get rid of that is to remove it. So you need a tummy tuck. The recovery for these procedures, because they're grossly different, is grossly different. People who certainly have subumbilical or mini tummy tucks, they can be done day surgery, and the people recover very quickly, especially if they don't need their muscles tightened. Obviously the bigger operations, which the full abdominal lipectomy, then people will stay in hospital. They will stay 2 to 3 to 4 days in hospital. Those sort of operations, all abdominoplasties actually are considered medical operations by Medicare. And so the Medicare item numbers applicable to it, even for a mini tummy tuck or the largest tummy tuck, there are Medicare item numbers applicable to it, which means that sometimes up to 50% of the costs are covered by the health fund if you're actually in a health fund. And these are not considered cosmetic procedures. Patients love having it. They tell their friends. Their friends come to have the operation. Again, it's an operation where the pluses are very high and the minuses are very low. Patients like having the operation. I like doing the operation. It very commonly produces very happy patients, and if the patient's happy, I'm happy. So it's an operation I really like doing.